working on a story more specifically focused on testosterone pellets. Can you kind of tell me a little bit about what those are?
So basically, human body uses hormones. Hormones are chemical messengers that are necessary for the function of organs at the cellular level. And as we age, these hormones, they deplete. In women, at about age 20, we start losing testosterone at the rate of 50% every year. In males, around age 30, and later on, we start losing hormones or testosterone by the rate of 3 to 10% every year. And that's a pretty, high rate of decline in hormones. Now, this testosterone basically is responsible for a lot of functions that are essential for the well-being of a person. Normally in women, we always think about estrogen and progesterone, and we never take testosterone into account, that how important it is for a female body to function as well. Whereas in a male, we already know that testosterone is the main hormone. So this was neglected for a long time. That testosterone, even in men, in women of course, but even in men, the hormones were not checked as a daily, as a normal physical, exam, when we go and do labs. So hormones were never checked. People come in, they start complaining, fatigue, muscle aches, inability to focus, decreased libido, lack of sleep, just inability to perform, in an energetic way, anxiety, depression. So they go to the doctor, they do everything except check their hormones and then put them on all these pills, antidepressants. Maybe now they're going to develop diabetes. Because with all these medicines also come side effects, when they're going to be on all these medications, and then you start gaining weight, and then you get put on more medications. So it's just a vicious cycle. But nobody was looking into checking hormones. But now we know that these hormones play a very, very important role, especially testosterone plays a very important role, not just in men, but also in women.
So talk about that role that it plays in women. What does that specifically do for women?
So in women, basically testosterone is very vital to keep the vitality of the body, like especially the libido part, the sexual function of a female. Also for bone health, for brain health, and prevention of breast cancer. So all these are very vital, and we think about, estrogen, of course, is also very vital in our body for, keeping our bones healthy, and also for the brain health, and also, fertility and all that. But testosterone has all these functions in a female body. It will prevent Alzheimer's disease. So that's why when you're young and you still have testosterone in your body, you don't get Alzheimer's, right? Rarely get diabetes unless you are insulin depleted, or rarely get heart attacks. So it also, testosterone prevents all that, and also is very protective for breast cancer.
So this is a very important then.
Yeah, so if you actually replace it, but then also we have to talk about how you replace it and what type of testosterone you use. That is important. You want to replace it, but you want to replace it the right way.
Okay. And so kind of what are some things that y'all use here?
So basically, testosterone comes in different forms. There's a synthetic form of testosterone, which is used mostly by traditional medicine. Is synthetic testosterone, which can be injections, creams, or pills. The Bioidentical system uses bioidentical hormones. So bio means plants, identical means similar to something else, right? So bioidentical, because they're plant derived, these Bioidentical hormones or testosterone hormones are plant derived, either from yams or soy, and they're also exactly the same molecular structure that our body produces. So they're bioidentical. So when they're replaced, when they're replaced in our body accepts them as its own hormones because the body already has receptors for those hormones. So when we give testosterone in the form of these Bioidentical pellets with the same molecular structure, the receptors on the organs will accept them very naturally, and that's why it functions better in our body without side effects. Very minimal, which I can talk about later, but mostly benefits, which it was giving to us when we were younger.
It basically just breaks then down or replaces what you've been losing.
Exactly. So what was good for us at one time, if you replace it again, it cannot cause harm to you, right? So it's basically you're replacing what was benefiting you initially.
Okay.
But now you can't produce it anymore. It's just a natural process that you start losing hormones.
How do you decide how much to put into a person?
So when a person comes in, and we see this a lot because these symptoms that I described to you, fatigue, inability to exercise, mental fogging, anxiety, depression, lack of sleep, lack of libido, these symptoms start in the 30s in both men and women, okay? The first thing is to do a blood test. Do not ignore the hormones. So we do check the testosterone levels. And if it's a menopausal female, we also check their estrogen. But the testosterone levels, like 99% of the times, are bottom in all these patients that I check. And they are, if they don't have any contraindications, they are eligible to get pelleted. So basically, what was your question? I lost the track of it.
How do you decide how much?
Oh, yeah. So when these patients come in and they have these symptoms of, fatigue, mental fogging, anxiety, depression, lack of sleep, lack of libido, we go ahead and do a blood test on them, which includes testosterone levels. And most of them, I'll find that their levels are bottom. So Bioidentical has a built-in system. We plug in the numbers of the levels, the levels of the hormones, and it gives us a dose. That will be the dose for that person. Okay. Now, a lot of times when the labs come back, the number may be in the range. So for example, if in a guy it says your testosterone range is 200 to 800, and so if he's showing that his labs testosterone level is 300, some doctor may tell him, or somebody may tell him that, hey, you're within the normal range. But he's not feeling normal. That's not optimum for him. Mm-hmm. So basically the Bioidentical system does not just look at the labs, looks at the patient and optimizes the levels to where they feel better. You understand? Mm-hmm. So Bioidentical hormone balancing or optimization is a whole different ballgame. It's not lab numbers. It's how the patient feels. And of course we have a limit to where we can go on the numbers, but we look at the patient more than the numbers. So we plug in the levels of the hormones, gives us a dose, and that's how we decide how many pellets he or she's going to get.
Okay. So this is for men and women as well. Okay.
Yes. I get a lot of patients who come in and they're having decreased sex drive. They basically come in like for an O shot or something else, or for sagging skin. And we have a questionnaire on our medical history that kind of gives me the idea that they're already having these symptoms, okay? And then I introduce them to Bioidentical. Literally, like, they're in it. They're like, ooh, I never thought about that. I'm feeling horrible. I would love to try this. And so it's not really hard to tell people about. And once we give them the information and they know that it's just a blood test, and when they do the blood test and when it comes back, like I said, 99 to 100% of the times they're bottom and they're ready to pellet.
How long has this been around?
So basically, pelleting has been around for decades, Mm-hmm. But this has been around for like more than a decade now, the Bioidentical system, and they actually have pelleted like 1 million patients already. So with like less than 1% issues, like there haven't been any recorded big issues that have been documented with the Bioidentical pelleting system.
Okay. Let's talk about the side effects then. What are some of
Mm-hmm.
the side effects, or what are the side effects that people may experience if, it doesn't go their way?
Okay. So basically, initially, if somebody has been, without their normal hormones for a while and they sought help or went to a doctor after, the symptoms have been there for a while, so introducing hormones into the body again can be a little overwhelming for the body. So very few patients may experience like some water retention, maybe, maybe some headaches and just feeling a little queasy. But it just goes away. It goes away in a few weeks. In the ladies, they may experience like a little acne breakout, maybe a few hair here and there, but it all settles down. So those are pretty much, the side effects. But testosterone really helps with also weight loss. So, the pot belly that the guys have without muscle is what, because they don't have testosterone, or the ladies start gaining weight after age 30, it's because they don't have testosterone anymore, so it really helps with that as well.
Okay. So, have you been seeing like maybe a growing trend in women doing this recently?
It's all about where you are. Like where I'm here in Beaumont, it's a lot of awareness. Like I really had to really go out and really talk about it. There's a lot of awareness. People are getting aware. They know something is not right. They know. The thing is that there has been a lot of scare about hormones in the past, especially with estrogen. There was this Women's Health Initiative study, which in 2002, which scared everybody that you're going to get blood clots and stroke and heart attacks and breast cancer if you use estrogen, testosterone. But it was a flawed study because they used synthetic hormones. So with synthetic hormones, you can have these issues, up to a certain extent. But now that, and a lot of people were very miserable because, they're not going to take hormones now because there was such a scare. But as we have more studies and since the Bioidentical system came out, actually when somebody gets Bioidentical, they tell their friends, like how, because they're feeling so good. That's how I get a lot of patients. And the other person is like, what have you been doing? You just look good, you feel good, and they tell them about. So I think it's just like, just really, when you're going to tell another person because you're experiencing it, that's like the best thing, that best way that it's traveling. Because, and then of course, I think everybody's talking about hormones now, especially, and I think in this day and age, we are trying to also go back to natural a lot, like organic and this and that. You can call this organic hormones, basically, So I think that's what it is. Yeah.
Okay. So, I mean, we hear all the time testosterone, and we think of men. Now, we're hearing testosterone with these pellets, and women are taking it. How do you kind of talk them through having something like this, testosterone, and how it actually benefits them?
So we just have to kind of, as a doctor, tell them what we know physiologically testosterone was doing for them when they were younger, because it's not like they were not born having testosterone. Okay, they have testosterone. It just started declining, or the production of testosterone decreased very quickly after age 20 or 25. It just declines. We just don't realize what's happening to us, because the only thing we're feeling is fatigue and muscle aches and just mental fogging and just being cranky. That's all we know. We didn't know that the reason is that the testosterone is not there anymore. So now you know what is testosterone doing for you. So it was keeping you calm, it was giving you mental clarity, it was giving you energy, right? Plus also it's protective from breast cancer, it's protective of Alzheimer's disease. It helps the bones from getting brittle, you know, the osteoporosis. So all that. In men, it's protective of from prostate cancer. Um, and then, of course, it helps prevention of diabetes, heart attacks. So it's a lot of, like, we know, we read in books. We know that. So that's why we just, coming from a doctor, they understand. Because then we're giving them factual knowledge, you know, information. So,
Okay.
yeah, it's easy. I mean, you know, they understand.
So when people are taking these, like, how careful do you have to be specifically in making sure that you're giving the right dosage?
It's easy because we are not going to do anything until we have a blood test and how low they are, and we're going to plug it into the system and get the right dose. We can tweak it here and there according to, we also always do a post lab at in a certain amount of time for men and women to see how high they went up and keep them within the limit, and also watching how they are feeling because we want it optimized. We don't want to just look at the number. So it's not difficult. It's very easy to monitor.
Okay.
Yeah.
And how important is it to make sure that you get the right dose for your patient?
Because they're not going to get relief of symptoms. I think it's important for me and them as well, because if they're going to spend the money, they want to see benefits, you know.
Yeah. So how does it work? How do you, I mean, is it just an injection or?
Yeah, so it's a little bit different. So it's in the form of pellets. So those hormones are compressed in these tiny pellets, okay? And so you're not going to take them by mouth, all right? So we're going to inject them in the fatty area in your buttocks, okay? It's done through through cannulas, like we implant them through just like the birth, you know, the birth control implants and things are done, is similar to that. Okay, so so they're implanted through those cannulas, and they're just sitting there releasing hormones into the blood. Okay, so in women, because the dose is very little in women, they run out in about 3 to 4 months. They melt up, you know, they melt down, and the hormones are all released, and then the symptoms start coming back. So you just come back and repellet. In guys, it can last, like the hormone release can last from anywhere from 5 up to 5 months, you know, and then after that the hormones are used up, or if it's a very active person or a smoker, they can get used up quicker, and then you have to repellet. Remember, some patients ask me, do I have to keep getting them? So I give them the answer. So if you have diabetes and you need insulin, will you only take injection for 1 day or 2 days or 3 days and then ask your doctor, do I need it? Well, yes, because you don't make insulin anymore. This is the same situation. You do not make testosterone anymore. Okay. Now in guys, we have to be careful because it can shrink the testes and can cause sperm count. Like the sperm count can be low. So if they're if they are planning to have children, like that couple, then we kind of have to coach them, you know, to kind of wait, or, you know, we kind of give them the guideline how they should do that.
Is that kind of the same with women then? Will that lower their chances? I mean, does it affect
No.
them in any way like that? No? Just the men?
No.
Okay.
It doesn't affect the women.
How long then? You were saying about 3 months? They have to come in about every 3 months to get this done?
The ladies,
Okay.
and the men about 5 months.
Okay. Yeah, because their body is more prone to have
Because
this.
also the dose they get more testosterone, you know, because they need more testosterone. Yeah.
Common that your patients ask you that maybe you want to just, you know, go ahead and let people know, like a common question or a concern that they may have.
The main concern is it going to give me cancer? The controversial issue of how the synthetic hormones are related to some degree of increasing maybe breast cancer or prostate cancer, causing heart disease or blood clots. These hormones are bioidentical, so your body's receptors take them as their own hormones, as its own hormone. So actually, these natural hormones reduce the risk of breast cancer, prostate cancer, Alzheimer's, osteoporosis, heart attacks. So that is the main message I want to give. Please don't be scared of getting BioT hormone optimization because this is natural. And this is the way to go if you want hormones.
If something were to come up, say some of these women or these men were experiencing some of these symptoms, about some side effects, the side effects that they were having, is there anything they can they come in and like get the pellets removed, or are those, I mean, once they're in, they're in?
It's very rare that they will experience any side effects, but we have ways of, like if you have water retention, we tell them to cut down your salt and, just things like that. Kind of watch that, and it's reassurance, mostly reassurance. Once the pellets are in, and that's why we dose it very appropriately, they cannot be removed. But I haven't seen anybody who will come in and tell me I want them removed because I'm feeling horrible. It hasn't happened, and it doesn't happen normally. So I don't think, and I hope not ever, but I haven't been in any situation like this. But usually we can manage if they have any issues like acne or something. I can give them some aldactone to help with that, or if they're having, some. We have laser hair removal here if they get a. So I mean, we can address issues. I don't think it's a big problem.
Okay.